Good morning, everyone. My name is Dr. Joubert, Desulme, aka Dr. J, and I've been practicing for over a decade. Well, I'm getting old, but it's not true. I've been with my wife for over 22 years. We have 3 beautiful children. Anna, who's 20, and I have one that just turned 12. She's in middle school. If you have any kids, you know how they change completely. I feel like I'm losing my little girl. And I have my the youngest one is my son, who's just turned 10. So what got me into chiropractic, right? So this is one of the questions that many people ask me, how did you get into chiropractic? I got involved in chiropractic because I was involved in a major auto accident and while I'm in high school. And I got T-boned by a truck and I hit a pole and I woke up at bed for 3 hours later. And I went to see a chiropractor. The way he treated me, not really treated me with respect, but he showed me that he cared. So I wanted to return the favor. That's when I enrolled at University of South Florida for biomedical science. And then here I am. Now I go to him, he adjusts me, and then he comes to me, I adjust him. So last time I did the presentation, I talked about myovision. Myovision is a new technology that we are using in the chiropractic field in Florida. Actually, in this area, I probably have 2 other chiropractors that are using this machine. What it does, when you scan the patient's spine, it gives you a baseline. That baseline, you can actually use that for, let's say, 4 weeks or 3 weeks later. You can retest it to see, after you start treating the patient, you can retest it to see how the patient responds. So this is what I'm going to demonstrate to you guys. Today is more visual. I'm a visual learner, so I'm going to show you guys how it works and how quick you can actually get the signal. So I have a volunteer, which is Jeremiah. So I'm going to put some information in there. Give me a second.
Oh, okay.
All right, so I'm ready to go. I know, right? Too. So with this machine, what it does, it actually scans the muscle tone. So go ahead and spin like this for me.
It's dense too, I want to let you know.
So what I usually tell the patient, just relax your hand. Just relax your hand, look straight. So now what I'm basically doing is I'm going to come in just like this, right? And just like that, it gives me a reading.
I'll Jeremiah go fast.
Everybody knows.
That's bad, right?
Test complete.
All right, so this is it. So what that does, it basically gives me a rough idea of what's going on with the patient. That doesn't mean there's something wrong with the patient. However, the colors identify different ways of what's going on. On the right, this is the ideal. 90% of us are not ideals because of things that we do. We work all day, we spend so much time on the computer, we spend so much time on our phone, we're looking down. So 90% of us are not ideal. And some of us work on construction where we're constantly bending forward and toward that other position. However, if you look at on the neck area, what you can see is that if you look at the red side, the red is actually, I hope that's not me yet. the red is actually showing that this is acute thing, acute injury that's going on. That it may not cause them so severe pain, but it causing the muscle to compensate. If you can see, the arrow goes to the right side. The one that's going to the right side, that's the muscle that's fighting to deal with what's going on. And then as you go green means clear. There's absolutely nothing going on with there. So there is no point of focusing on treating the patient that area because it tells me that he doesn't need it. And then when you go down here, now on this area, so when I see this, I usually ask the patient, is there an injury? Something may have happened that may have caused that. And what you usually see, the patient have a history of something going on, but that doesn't really tell me anything until I do the exam. So that give me a baseline of what's going on. Then what we'll do the exam and find out what's going on. During the exam, I may feel some discomfort. Usually when we have a discomfort, our bodies just deal with it, we just keep going, unless it stops us from doing what we normally do. Over time, that's when it starts causing problems. It can lead to, well, let's say the vertebrae, when something like that happens, the vertebrae is supposed to sit like this. Everything's supposed to align, right? And what usually happens is that this become misaligned. When the vertebrae rotate, now it's stuck in that position. It may not cause you pain, but over time, it gets worse and worse. So if I'm having pain on the left, I'm going to lean on the right. As I lean on the right, it can start leading to what they call degeneration. I'm going to have this pass out. I'm passing them out to show you different stage of degeneration. This is how the spine is supposed to look. And this is when it happens when it starts degenerating. So let's say I have an injury. Let's say I was involved in an accident. So the vertebral rotate is taking that position based on the severity of the injury. It can start lead to what they call a bulging disc. The bulging disc actually start what also known as the pinch nerve. As we leave it alone, we don't take care of it. It gets worse. It can become a herniated disc and also lead to severe degeneration, where the spine is actually what they call bone on bone. And when you start to see what they call anterior osteophyte, this is that little bone that started meeting with one another. And this is why you see a lot of patients, when they turn their head, instead of turning like this, they're turning the whole body because they have lost the range of motion. Over time, that's also affect your posture. So now I'm going to click on this where we have the red. This is something many times we focus on the pain, but we're not focusing on the autonomic nervous system. The autonomic nervous system means this is what's going on. If I have any discomfort in that area, this is the area that it affects. So as I click on this, watch what happens. See, each area of associated with certain area of the autonomic nervous system, which is when we talk about autonomic nervous system, we're talking about the organs. So with this something that we don't control. So from T1 to T4, innervate the heart and the lung. When you have any misalignment in that area, what it's going to cause, you can even look at it over here if you can see it. If you have any effect in that area, it's going to cause difficulty breathing. It's going to cause bronchitis, especially on older patients. Older patients tend to, whenever the weather change, they are more prone to have bronchitis. The reason being is because a lot of times they sit a lot, they collapse the lung. So when the weather changes, the immune system drops. At the way the immune system drops, they're not breathing properly. So when they have a cold, they are more prone to lead to bronchitis and pneumonia. And then you can actually follow it all the way through, even the lower back. When you have lower back, so if you have some lower back issue, it can actually affect your organs. That this is for your kidney. This is the prostate gland. It also can affect your bladder. This is why a lot of women after they have baby, they end up with incontinence, right? So because now the body is getting pressure, that constant pressure started affecting the body. So the more it affect the body, the more problem we have. But overall, we focus on the symptoms, right? But not the cause, right? As we continue taking medication, there's nothing wrong with medication. Sometimes you need it. But when you continue taking it, we're not taking care of the cause. Over time, it's getting worse and worse. And then when you go and get an X-ray or an MRI, it shows there's a sign of degeneration. So many times we've seen those things happening because we're not taking care of the body the way we're supposed to. So when we do this presentation, it's basically to kind of educate you what's going on and how to better take care of yourself. I know it's a short period of time that we have. Thank you, Jeremiah, for helping us. And this is what we are bringing to the community to actually give you a baseline of what's going on and how to better take care of yourself. Thank you so much.